today, just for the opportunity for Colorectal Cancer Awareness Month, I'll talk about some facts and some fiction issues around colorectal cancer to increase awareness around colorectal cancer and dealing with colorectal cancer. So colorectal surgeons are always people make fun of us all the time, so you can't take yourself too seriously. So I just thought I'd start off with this, even though I'm probably taller than most people, but that can't be changed. So we'll talk about some misconceptions about colorectal cancer and try to understand more about it and understand what it's all about and what can be done to prevent it. So some are facts, like death and taxes, that we know that's for a fact, and then there's some things that are fiction that don't really exist, but people believe that that's therefore true, and you have to sort out one from the other to properly understand what's going on. So the first thing that people think that colorectal cancer is not common and it's more of a rarity, and that's not true. That's fiction. Colorectal cancer is very common. There are 135,000 new cases every year just in the United States that are diagnosed. And it's, in terms of frequency, it's the fourth most common cancer in this country after prostate, breast, and lung, and the second most common cause for deaths after lung cancer. So it certainly is common, and it certainly causes a lot of deaths that could be prevented. The other people think that cancer doesn't happen to them and only happens to older people who are not younger people, and that again is not true. Cancer is kind of an equal opportunity disease. It can happen in young people, old people, both genders, across all races and ethnicities. So everybody, unfortunately, is prone to get cancer, and something to be aware about. It affects men and women equally, unlike some cancers, and actually African Americans are more likely to be diagnosed with colorectal cancer in later stages and have worse outcomes as compared to other races in this country, and that's again an area of research. A lot of people think that if they don't have any symptoms, they can't have cancer, and again, that is not true. Colorectal cancer, most cancers don't cause symptoms. However, some symptoms are worrisome for colorectal cancer, and people need to be aware and understand that. The two most common symptoms that people present with that are worrisome are rectal bleeding or change in bowel habits, and that can be blood of all sorts, mixed or without, in the stools, and something always should raise off alarm bells and make people concerned about it. So change in bowel habits, if everybody's bowel habits are different, and it may be right for one person to be different for the other person, but if what is normal for you gets changed, then that's obviously a change and something you should talk to your primary care doctor about. And same thing for bleeding. No bleeding is normal, so anytime that happens at any age, at any time, usually it's something insignificant, but again, it always could be a marker of something more serious and something people should be aware about. So some more facts about colorectal cancer. People with a family history of colorectal cancer are at an increased risk, and that's not just cancer, but also polyps. So if you know anybody in your family, that certainly increases your risk. And then when you talk about family history, that usually means not your next door neighbor, but people who you know you're related to directly. And the other thing to remember, it's not just cancer, but if anybody who has colorectal polyps, that's the same risk as having cancer. So that's something one needs to be aware about and be in tune when people look into their family history. Again, parents, brothers and sisters, grandparents and second cousins, all are family members, and if anybody of them has any history of cancer or polyps, that means that you have a family history and you should know about it. There are certain conditions like Crohn's disease or ulcerative colitis that are not that common, but if you do have them, that certainly increases your risk more than the average person, and that is again something one needs to be aware about. However, what's most significant is that 75% or 3/4 of all cancers that are diagnosed are in people who have no known risk factors. So there'll be people who don't have any family history, won't have any other inflammatory bowel disease or any other predisposition, other than the fact that they are over 50 years of age. So again, most cancers are diagnosed in people who do not have risk factors and may not necessarily have symptoms. And again, that's why one needs to be more aware about it and not wait for something to happen to react or respond. The American Cancer Society recommends that all men and women starting at age 50 should be screened for colorectal cancer. Just like women get pap smears and mammograms, colorectal cancer is the same way. It's a screening strategy that we will talk about that applies to all men and women over age at 50. Screening means to check for cancers when you don't have symptoms. It doesn't mean that you wait for something to happen. It means to react or respond before something happens. And that's why we screen people. And again, that's why, because an ounce of prevention up front can prevent a lot of problems downstream. And that's where screening becomes critical. When we talk about the different screening strategies that are available, currently these are the 4 most common ones that are available, which is a stool occult test, sigmoidoscopy, barium enema, and colonoscopy. And then more recently we have the virtual colonoscopy or the CD colonoscopy. All these modalities are better than having none. So in general, colonoscopy is every 10 years, the other ones are every 5 to every year, so that factors in. Obviously, there are some issues with colonoscopy that people are concerned about in terms of the prep. But again, if it's done, then you're good for 10 years. But the key thing is something is better than nothing. And all of them are equally good if they're done. So that's very important that people get screened for colon cancer so it can be detected and treated appropriately. So the other thing people think that getting colorectal cancer is lethal and it's a fatal disease. And that, again, is not true. Colorectal cancer is one of the most treatable cancers if one gets it. 90% of all patients with localized cancer are alive at 5 years after their diagnosis. And that's certainly a very good number in terms of cancer survivorship. However, unfortunately, only 1/3 of the patients who are diagnosed with colon cancer are diagnosed at that stage. And 2/3 of patients are diagnosed when it's much more advanced, when treating them and curing them becomes more challenging. So if it's caught early with screening, then certainly it's a treatable and curable disease. When it's not, then obviously it becomes more challenging. But still, with advances, even people with advanced disease, they can be treated and have good outcomes. A significant thing that a lot of people ask me that when they come for colon cancer or they think they have colon cancer, everybody will have to have a bag or a colostomy. And that is not true. Certain number of people will require a colostomy, but most patients, if they're treated by specialists with special training in colorectal cancer, will not require to have a bag or a permanent colostomy. And most people will have normal bowel function. So having a colon cancer or a rectal cancer does not mean that they're going to have a bag, which a lot of people are concerned about. And part of the reason why they don't go see a doctor or get treated is because they think that if they have cancer, they'll end up having a bag, and they have misconceptions about it. But most cancers, if treated by an expert or a specialist, will not lead to a bag and in fact can be treated appropriately. So, in summary of the things we talked about, it's the second most common cause of cancer deaths in the United States. 2/3 or 75% of all cancers occur without any risk factors other than being over 50, which is why screening above 50 years of age is very important. 90% of the cancers are curable if they're found early, which again why screening becomes critical, and is certainly preventable by removing polyps. So that's why we screen people for colon cancer, but if we find the polyps, we remove them and prevent them from turning into cancer, and that's why it's critical for people to be screened. So the question becomes then, what can you do as a patient or as an individual? How can you contribute to your health? So know your family history, know who has cancers, who has polyps, and be aware of that. Make healthy lifestyle changes, which means no smoking. Smoking in itself raises the risk of colon cancer more than having a family relative. So very important to not to smoke, which is easier said than done, but critical. Again, alcohol has been one of the few things that is modifiable to be associated with colon cancer. And again, that's something that is easily preventable. You can't change your family history, but you can certainly avoid alcohol. So know your family history, make healthy lifestyle changes, and then talk to your doctor about screening. So that's kind of what people have, that people, when they come to my office, they all come in disguises and they don't want to be recognized to be in a proctology office. Thank you very much again.